Home care for me initially was more of a practical thing. It was the flexibility of home care. I wanted to have more time with my kids at home as they were growing up. Once getting into it, you realize just how much you become a part of that person's actual family. A typical day for me starts with taking a look at my schedule, making phone calls to make sure that things didn't change in their medical status. You need to call the doctors, team members. Communication is a lot of our day. And then just going about my day, going from patient to patient, doing their treatments. A physical therapist comes into a patient's home and assesses any safety issues, as well as get them back to the prior level they were before whatever medical incident changed their situation. Really trying to teach that person to become as independent and motivated to maintain their health. So let's have you scoot back, and then we'll do the leg kick where you're gonna hold it out. But being in their home, you get to know that more quickly. You really get to see what they have to deal with on a day-to-day basis, so you can really cater it to what they actually need to do in their own home. My ultimate goal as a physical therapist when I discharge a patient is that they know what they can do to not just maintain their status, but to further progress, give them a little bit of empowerment that they have control of this. One patient that I remember, she had just gotten home from the hospital. It happened to be a really nice day that day, and she mentioned that she hasn't been able to get out of the house and would really like to go for a ride. We were able to safely assess the car transfers, and when she sat in the car, she started crying. She said, "I didn't think I'd ever be able to do this again." I think we forget a lot of how important those little things are. We take for granted how easy it is for us just to leave our home. When somebody conquers that challenge, I feel grateful I can be a part of that. The advice I would give for someone considering home care, know that you will get very good training. I was very impressed by the amount of training we did receive. Everybody wants you to succeed, and they'll work at your pace to help you be as successful as you can be. The most rewarding thing about my job is connecting with my patients. To be able to just be independent with small things in the home is a really big deal to our clients. To be a part of that is very special.